My name is Dr. Aamer Khan. I'm a co-founder of the Harley Street Skin Clinic with my wife Leslie, and what we have is a clinic that's dedicated to providing an integrated service. That's anything from skincare all the way through to plastic surgery for our patients, so they get the best outcomes according to what their goals are. Today we're going to be seeing Jan, who has developed some white plaques just under the skin, below and above her eyes.
Today I'm here to see the doctor for a consultation for the lumps that I have around my eyes. The lumps are cholesterol, not medical, because I've had the blood tests and my cholesterol level is normal, so they are deemed to be hereditary, as my grandfather did suffer with them.
The plaques are called Xanthelasma, and they're deposits of cholesterol in the skin, and they can be quite distressing from a cosmetic perspective.
I'm very self-conscious of them, to the point that I tend to hide a lot behind my fringe and look at the floor rather than anybody face on. So I'm hoping that once these are removed, I will feel more confidence in myself.
Come on in.
Thank you.
Come and have a seat. Just facing me.
Thank you.
That's lovely. Okay. We have a number of options as to how we can deal with these plaques. One is conventional surgery, where they're cut out surgically with a scalpel and then sewn back together. Now the skin of the lids recovers very well and it heals extremely well. However, there's only so much skin one can cut out before it starts to contract. So today what we're going to be using is radiofrequency ablation of the actual skin and the plaques. I'm going to make a few marks on your lower lids as to where the xanthelasmas are, and then we're going to go ahead and take those out for you. Now this involves radiofrequency probe, which is electrical energy which vaporizes water molecules within the tissues, and it allows us to expose the plaques, which we can then cut out with the radiofrequency probe. Just a very fine tip. It's called a very tip because we can adjust how deep we go. Cosmetic surgery isn't always for vanity purposes. Sometimes people have blemishes and they have conditions which are very, very distressing from a psychological perspective. And physical deformity also can cause lots of psychological and social problems. Now, there are different ways of addressing these. Reconstructive surgery is one, which is cutting surgery, but that in itself can leave its own marks behind, like scarring and its own deformities. Okay, so this is a suture that we're going to close the skin with. It's very fine, it's finer than a hair, and we're going to do a running stitch. The aim of cosmetic surgery is to get the best reconstructive and cosmetic outcome that we possibly can using the technology that's available. So I'm just stitching now, and whenever we have to stitch, we have to spend the most time really of all the procedure on the stitching part, because this is what gives a nice cosmetic outcome. After the surgery, she'll have some raw patches under the eyes. They're open wounds which will heal very, very quickly. So within a week to 2 weeks you should see them closing off, and then the skin will mature, and after about 6 to 12 weeks you wouldn't know that she'd ever had anything done. How's that for you?
Wouldn't feel a thing.
Good, excellent.